right, we're back again with part two of our functional medicine series. We're speaking with Dr. Chester Dickerson, and so today we're going to ask him what can be treated with functional medicine?
A lot of things can. For instance, metabolic diseases such as prediabetes and diabetes, autoimmune disorders, fibromyalgia, tired, fatigued, cardiovascular disease, gut issues, mental health issues, and even people who are undergoing chemotherapy and radiation for cancer treatment. For instance, I've had two different people who had the same disease, because the Western people name their diseases. However, we all have what we call biochemical individuality. That means no one is at all alike, other than genetically. So if you have two patients who come in with diabetes, I can guarantee you they will not be treated the same way. I had a patient who had an A1C of 13 and was told she would have to go on insulin and probably dialysis. And she called me up and she says, well, she was told to go to the emergency room. And so she calls me up and she goes, should I go to the emergency room? And I said, well, yes, of course, because I'm not going to go against her doctor's recommendations. We did worked on her diet. That was her main problem, was her diet. And I told her she'd have to give me at least 3 months to work on this, because that was when her next A1C test would be. So we changed her diet. We didn't actually take anything away. We just added new things and crowded out, is what we did. We crowd out the bad, add the new, because we don't want anyone to think that, that they're eating bad things or their habits are bad or whatever. So by the time the third month came, I had her, at each month I had her take her fasting glucose every morning. She was only fasting 8 hours, which didn't really give us a true number, so we extended it to 12 hours. Then we took all those numbers, divided them by 30, and we did that for 3 months. And then we plug it into a formula, and you'll get your A1C. So her A1C came down to 6.4. She goes in to see her doctor, and the first thing her doctor says, well, I'm surprised to see you that you're still alive. So that was not a good thing right there. And she said, we're going to do your A1C, and my patient says, well, it's a 6.4. It was a 6.4, and so she didn't have to be placed on insulin. Dialysis out of the question. However, the doctor refused to drop 3 of her diabetes medication and said that if she thinks it's a fluke, it could come back in 3 more months and we'll check it again. So we went back in 3 more months. It was still in the 6.5, 6.6 range, and she got dropped down to only metformin.
Okay, that's a really good improvement, isn't it?
Yes, it was amazing.
Nice.
She hated me for the first 2 weeks, but after that it was fine.
Good, good. So why see a functional medicine practitioner?
If you want a more personalized experience, if you want to spend more time with your practitioner, if you want to be empowered to where you have control of your health care or your well-being, because that's what we do, is we provide health. If you want something that's cost-effective over long-term health, I mean, it's more expensive to be sick than it is to be healthy, but it's not cheap to be healthy. If you are subjected to, let's say, diabetes or high blood pressure or cardiovascular disease that's in your family, well, your genes aren't your destiny. So what you can do is get into a treatment program or a treatment plan where we can keep those genes in check, and you won't necessarily end up having diabetes or end up having cardiovascular disease.
So how do you know it's time to see a functional medicine practitioner?
The biggest one is if you have a chronic disease that has not responded to conventional health practices. Another thing could be you could have digestive issues that won't go away, or autoimmune symptoms that you can't get back into remission. If you want just to optimize your health or just have general health, general well-being, we focus a lot on prevention. So if you know you have these genes or whatever, we want you to do something where you can prevent going there. However, if you do have a disease, we've had patients that have actually had that disease reversed, but we can at least slow it down. We do that in dementia a lot. We can slow down the progression of dementia even.
Gotcha. So it's a lot about being proactive.
Yes. Mm-hmm. Yeah. The patient has to be involved in their journey.
Gotcha. All right. Well, thank you for your time today. Appreciate it.
No problem.